this field a long time ago, really starting out looking at service quality and morphing into healthcare quality. And I started looking at patient experience data and seeing that patient experience data really was as good a predictor of downstream outcomes for the hospital as objective data on how the doctors were giving beta blockers or things of this sort. And we published a lot of that work in medical journals. And I think it's had some effect. But stepping back and thinking about if we're trying to improve healthcare, the economic theory says that we should get more competition and we should have knowledgeable consumers that can talk to others and spread the word, say who are the good doctors and who are the bad doctors, who are the good hospitals, etc. So that requires two things. It requires competition and requires knowledgeable consumers. So how do we pass this knowledge on? Are there knowledgeable consumers? So if you look at the patient experience data, normally when we get this, and it was mentioned through HCAP data and third parties like Press Ganey, who measure the experience data. But there's these new sources now of data which are coming with patient reviews. And you have Yelp and Google and other third parties. And so the question I'm posing here is, can we look at these reviews of patients where they're talking about their experience? And it's a different sort of data. It no longer is just objective yes, no answers. It's text. And we know how to analyze text. And we know that it's going to provide emotional sorts of things, but also objective measures. And so the real questions here are these reviews of doctors different from reviews of, say, of hotels or of restaurants? If so, why? Can we get new information from these data? And then can we determine if there are different segments of patients? Because in fact, we need knowledgeable patients to provide this. And how do new customers look at these data and how do they knowledgeable or not? And are there enough knowledgeable consumers to really regulate the marketplace? And so if you look at the data, we have patients that go to ER rooms, and they're probably going to talk about the length of time it took. But do they go to a hospital or a clinic? They're going to be very different sorts of information. And can we figure out which information is most relevant in predicting downstream measures of performance? And if you want to think of it on the flip side, so we go to the second side, Chris, you look at how do the organization react to these data. Right now, we know most doctors really don't like patient experience data. Any information, but will they start paying attention to the review data? Will management from hospitals and insurance companies pay attention to it? Because if they don't, then one of the theories about why we get more efficient behavior is that the customer can monitor and regulate things through information. Well, if the hospitals are not paying attention to this or insurance companies aren't paying attention to it, it's going to have less effect. And so where will this information have its most impact? On the medical staff or on the insurance companies? And do the reactions of this information vary? Is information about bedside manners more important than receiving faulty advice? For instance, if a review says, my doctor sent me to get this very information and the test didn't work. Anyway, there's lots going on. I'm the last speaker as usual. Having my name being ST, I've never been on the lead first author. Anyway, with that, I say there's lots of information and topics there that I think are very relevant. Thank you.